Hello and welcome to the National Press Club of Australia and the Westpac Address. Coming to you from Ngunnawal and Ngambri country. My name is Julie Hare and I am the Education Editor at the Australian Financial Review and a board member here at the Press Club. Our guest today is Professor Manu Platt, the 2023 ASMR Medalist, to make his address here at the club. Professor Platt is a biomedical engineer whose research spans global health, tissue engineering and personalised predictive health. His long-term focus has been on a type of enzyme that plays a role in a variety of diseases, including cancer, cardiovascular disease, osteoporosis and arthritis. He's also had a hand in big public health initiatives in South Africa and Ethiopia, understanding why the same type of breast cancer affects individual women differently, and he's also been helping babies born with sickle cell anemia get past the age of 16. He always wanted to change the world, but he didn't think it would be in biomedical engineering. His first career goal was to work for NASA doing biological research, but one thing led to another, and he found his way into academia and research, which has been working out pretty well. Professor Platt was inducted into the American Institute for Medical and Biological Engineering College of Fellows in 2019 and has now been awarded the Australian Society for Medical Research Medal for 2023. You can follow the conversation at Press Club Aust or hashtag MPC. Please welcome Professor Manu Platt.
Good afternoon. Thank you for that wonderful introduction. I forgot she's a journalist, so she looks up things that you didn't just send in your bio. This will be a great lunch. I'm extremely grateful to the ASMR. Some may know the story. I was initially selected for the award in 2020. We all know what happened in 2020 that delayed that. And so 3 years later, I get to actually do that, and I've been patiently waiting in the Sydney airport for 3 years until they actually let me in to get the award. So very excited for my patience and for your keeping me on your mind. I want to thank the organizers and my hosts at ASMR, and then all of you, of course, here at the National Press Club. So it's been great to visit Australia, and I've been giving talks at a few different places, and kind of where the theme of my talk has been is that we can all be scientists. As mentioned or in my bio and as she discussed, scientists can look like anybody. They can have any kind of interest and they just want to do science. And that is one of the things that I like to bring into the world. And being a professor really allowed me to do that in ways beyond what one might have imagined from just thinking of what a professor can do if you were on the outside. So again, my talk is kind of the theme of it is that we can all be scientists and better allies. So before I really get started, I do want to say this. Some people connect with this, others don't. My favorite two Australians, I've met some great people today, so I'm keeping tabs, but my favorite two Australians before arriving are George and Shani from Australian Survivor. Special place in my heart for both of them, and George is a politician, so I was maybe hoping he would be in this crowd today. But Survivor has taught me a lot about life, and I think a lot of people think scientists are these nerds and it's all calm and quiet, but those of us who are scientists in the room know it's a rigorous, tough game. And Survivor is a rigorous game that allowed me to really think about how to interact with my peers in different ways. So I do want to talk a little bit about my mentoring work. I used to have a video that I would show, but I'm not showing that here because I'm not going to spend a lot of time on that, but as a Black American, it has been important to me to set up new programs, create spaces that other Black Americans can come and do science and engineering. Because many of us, I have been the first this, the first that, the first Black this, the first Black this, the first Black that throughout several steps in my career. And I'm not saying it gets old, but it's important to make sure I'm not the last one that comes behind those doors. And I know the reason why I may be the first in certain spaces, but what I also am really careful about is to make sure that those that I bring in behind me stay in those doors. Because one thing that really upsets me is the loss of Black talent or brown talent. And it can be a few small interactions that may have someone thinking, I should never do science, I'll give up, I'm out. And we can't just say, bring people in for the numbers, and then they're at risk of being driven out by the behaviors and the culture of the society. So I think those of us that do want to increase the diversity in our spaces, bring them in, but also think, how can we change the space to make it safer, or make sure they go to the safe space while we do the work of changing the other environments. And so along with that, with my former mentor, I say former only because he passed away right at the beginning of the pandemic, Professor Bob Neerum, we started Project Engages at Georgia Institute of Technology. So Georgia Tech, for those that don't know, it's in the state of Georgia. So whatever you think about Georgia, put that to the side. It's in the city of Atlanta, which is an incredible metropolitan urban city. It's a wonderful place to live, and the biggest and busiest airport in the world, so we can fly direct to most cities around the globe. So since I've moved to DC, I'm learning about this bus changeover or flight changeover thing. I don't know, we didn't used to have that when I lived in Atlanta. But so Georgia Tech is a top-ranked biomedical engineering program. It's a top-ranked engineering school. And it's right in the heart of the city of Atlanta, but a lot of the students that are Atlanta residents were not coming to Georgia Tech for their undergraduate education. And it's a public school with quite a low tuition cost. Plus, Georgia has this policy called the Hope Scholarship, where the lottery actually allows money for Georgia residents to come to public universities in Georgia for free, or for no tuition, right? And so Bob Neerum is an older white guy, old white guy, okay? But had this epiphany about, Manu, you know what we should do? We should really try to make sure we get some of these high school students from Atlanta into our university. Because in the United States, there is a dearth of people entering STEM fields, and we must tap into all of the population so that we can have scientists, mathematicians, and engineers to meet the global needs and the country's engineering workforce. All for it. And so again, having an older senior person who could push power levers in places where I could not, and partnering with him where then I could be the liaison with the parents, with the teachers, with the students themselves. And of course, we had a wonderful program manager, Ms. Lakita Servance, because I said I deal with the parents. I don't deal with the parents. That is not my ministry. But she could actually deal with the parents, and I can work with the students. And so that triumvirate of us three, we're actually, over the last 10 years, able to bring in 140 students. They're working in Georgia Tech research labs with PhD students and with postdocs. They're publishing papers. And then the really critical piece to the success of this program is we actually pay them to do research. So imagine you're in high school, and the schools that we work with were in low socioeconomic, the Atlanta public school system in general. And so it was all free lunch at these universities, at these high schools, which give an indicator of the socioeconomic status. So we, or it's Bob's idea, which I applaud him, decided to pay them $10 per hour, 10 US dollars. Now, that means nothing here in Australia, okay? But where I live in Georgia, the minimum wage is still $7.25. It has been that since Bill Clinton was president and he left office in 2000. So we were paying them $10 an hour pre-pandemic, hottest job on the market. And the reason that's important is many of these students, they would go work retail, they'd go work fast food to help their families and support them. I was working fast food when I was in high school, but no need for them to come home smelling like grease, chicken, and all of these things and making no money. We've now increased it to $15 per hour about 2 years ago, and most of that, it began being partially federally funded, but with a huge 67% was philanthropically raised, and now we're all 100% on raising the funds philanthropically. But it's so important. And so I'm not gonna talk much, I said I wasn't gonna talk much about it, and then I spent way too much time talking about it. But that was actually one of the programs that made it challenging to leave Georgia Tech and take on my new position at the NIH. So I won't talk much about it because I don't want to cry. But I've moved to NIH, as mentioned in the introduction, and I have become a federal employee. Whoops.
Please try again.
I know, Siri, I don't know what happened. And freewheeling like this is super interesting because now I've got a bit stream of thought. What was interesting is when this new position became available in NIH and I was being recruited for it, it was just really funny that a lot of people thought that what would keep me at Georgia Tech was leadership roles and expand my diversity efforts and to give me new positions there. And I just had to tell people, if I never have to run another diversity program ever again, I'm happy for it. I'm a scientist, I'm an engineer, I'm a nerd. That's what drives me. If I did not have to care about any of this diversity stuff, the things that I could really get done would be amazing. But why do I need to care about it? because I want people around me that relate to the work that I do. I do a lot of work with racial health disparities. Also, somebody opened that door for me, and I need to do that. But also, I need to be able to recruit students to my lab. And I need these things to change. So it is a part of my job function, but it is not why I became a professor. I, as a Black American, was driven to do scientific research by scientific research. So anyway, I'm gonna move past that, but I do scientific research even at the NIH. So what they wonderfully did is in this new center that's being created, the Beta Center, Biomedical Engineering Technology Acceleration Center. It's at NIH on the campus. Many of us think of NIH as sending money out to the world and around the country to fund biomedical research, but they actually are a campus with intramural researchers on campus. And the beautiful thing about being on the intramural campus is we don't have to write grants. I'm gonna brag to all of you out there in the grant writing field. Ha! And so, starting this new center is actually to tap into the other intramural researchers to get them to think about how they can apply biomedical engineering techniques to their own research. Because NIH at heart is a medical campus at root. And so that's been an interesting thing. As we were talking in my wonderful introduction, all of the different research areas that I cover, I love these proteases, they're at the center of everything, but they work in so many organ and tissue diseases that now my job is to connect people across different diseases. It's a dream. But I also get to connect others, but also make my own connections, and so I'm super excited about where our work will go. I would talk more about sickle cell disease, but as I mentioned, it's not really affect a larger population here in Australia. But in the United States, it's the racial health disparity. It predominantly affects African Americans in the United States. About 100,000 African Americans have sickle cell disease, and but it's largely a global issue. So 300,000 babies are born each year with sickle cell disease, largely in sub-Saharan Africa, the Indian subcontinent, and the Arabic world. So it got to North and South America through chattel slavery, and that's how we now have it, and that's why it predominantly affects Black Americans. But children have strokes with sickle cell disease. And again, what keeps me going as a scientist is the passion to do the work to help people. So I'm finding out when I started my own individual professor lab that children were having strokes. My PhD was all about cardiovascular disease and studying plaques in people in their 60s, 70s, and 80s. But we're talking about children between the ages of 2 and 5 having a stroke, and these are little Black children? And it's because of a genetic disease? We had to jump in. And there's so many important engineering questions there. How the hemodynamics change because of these stiff red blood cells that are stiff because of the sickling. So that's what we've been played a part of. Georgia has a huge sickle cell population. And we don't just work with the researchers, I also begin to partner with community-based organizations. Because the people who actually are living with the disease clearly have run their own tests and their own experiments on themselves, particularly a marginalized population, right, that there's not a lot of funding for sickle cell disease. They're trying to make their own life better on their own. And me, it's not, I don't have sickle cell, it's not really in my family, but the conversation that I have with people and learning about the ways that they have done hypothesis-driven research on how they feel better is really phenomenal, and it allows us to then advocate to get more money to come and fund sickle cell disease, particularly in states in the United States where they have large populations. But also we need to try to bring that money at the federal level. And so that's another reason that I said, we'll go to NIH, because by being at NIH, the funding that I receive to do my research is already a large increase in funding sickle cell research in the United States. So again, now I want to change the story to kind of ways, there are young people in the audience, junior scientists, maybe a few, professors, and definitely if you're watching at home and you're a young scientist, I'd love to share this story about how I kind of started to think about policy and how we as scientists must not just think about the lab, but if we want to have impact, there's a broader world. Like many of you who are science majors, I was a biology major at my undergrad institution. It was a liberal arts school, so there were lots of English majors, anthropology majors, history majors, and I used to laugh at them because I was like, oh, you've got it so easy. It's so hard for me, I'm taking biology and physics and calculus, and what are you doing, reading, whatever. But I had to go back and apologize to those people once I started working in the HIV/AIDS world. So in 2009, when I had just started my independent research lab, there was a call from the federal government, had put in money to solve a problem. The NIH and the International AIDS Society put out a call to bring new investigators to HIV research. The antiretrovirals had been doing really well. This is, again, before AIDS turned 30, okay? Antiretrovirals were doing well, extending life, but they found that people were dying of other comorbidities, cancer, cardiovascular disease, bone disease for some of these. And I said, huh. And they realized, instead of just virologists, let's try to bring in other people that weren't here before. So I was a junior professor. They brought in 22 of us from around the globe. 6 of us were from the US. I knew 2 were Australians, Clovis Palmer and I think Justine Minturn. And we got the Rooter to the Tutor HIV/AIDS from 1981 to 2009. And it was opened with Dr. Francois Barré-Sinoussi, who had just won the Nobel Prize for identifying HIV as a causative agent of AIDS the year before. She's in this room with 22 of us young professors and postdocs. Right? It was amazing. And what she did that really helped sculpt the shape of my early parts of my career was she was at the Louis Pasteur Institute. They had been working on the 2 human retroviruses that had been identified, but they both cause cancer. And actually, one of them is actually a problem in some of the indigenous populations here in Australia. I learned when I was visiting here in 2014 for the AHMR Congress. But she said the issue was they had to rethink everything they knew. Because the other human viruses cause cancer, the cells would keep growing and you could study them. HIV was killing the T cells, so they had nothing that they could culture and grow. And she tells us, young people in this room, that she, Nobel laureate, they had to rethink everything. They stepped back and said, don't start with dogma. Now, scientists in the room, science is history. We build on things that have been found in the past. So to say, step back, open up the box, and let's do some new thinking. Right? Because that's the way my brain works, and I want to study questions that people aren't looking at. So you've got to generate new ideas, almost de novo. So that was the first piece that really stuck with me. So again, young people, stay in the history of it, but then sometimes you have to start fresh. COVID-19 was a huge example where people had to start brand new ideas. But what I also learned is those HIV/AIDS meetings at the World AIDS meeting, that year was in Cape Town, and I then went several years afterwards, is that the scientists and clinicians had to be advocates for their patients. Now, they did it, we getting our PhDs in science, we didn't even learn budgeting, right? And we get these large budgets. We definitely didn't learn about social justice and activism. But the early scientists and clinicians had to advocate because of the stigma surrounding HIV infections. Again, I grew up in the 80s and 90s, and people getting kicked out of their jobs, no one wanting to take care of the patients. So the doctors got on those front lines, such that at these World AIDS meetings, they have protests throughout the conference. And I was just shocked as a young scientist and engineer being like, why are people on stage shouting and yelling? But it was important because if they wanted to get the problem solved, then they had to advocate for their patients and then bring in the anthropologists, the English majors, the history majors, the people who understand cultures. Because if we have the best small molecule or the best strategy to fight a disease, but the people we're targeting do not take it up, nothing, right? We've done nothing. So that was a huge lesson there. So there was a march through the streets of Vienna, Austria at the meeting in 2010. And I was actually walking by the people who were the sex workers. They had red umbrellas. And that was the first time I heard this term, which now we've heard other places, but sex work is work. Sex work is work. They support their families with the work that they do. They pay their bills. They pay their rent. It is a job, but they are the ones that get stigmatized, not the people that were their customers. So in parts of the world that they were not seeing them to help stop their disease, guess what? It doesn't stop the public health problem by putting stigma on populations. Again, mind-blowing at these conversations. And so the big message I took home was the importance of being a scientist activist, right? You used to think if you're a scientist, you can be in some small little room and what you do and it doesn't matter. But we do need to be out there talking to people. And now I tell people sometimes we have to out ourselves as scientists. In America, people don't think I look like a scientist for a number of reasons, okay? And you wouldn't believe how many times I've been on the front of an airplane and somebody says, oh, what do? You play basketball? And I was like, no, I'm a scientist. And then they say, no, you're not. Yes, no, you're not, whatever. But that became important during COVID-19. I'll talk about COVID-19 later. Oh, there's free will unless we do too many things. But think globally and then act locally. That was the message in the after-school specials that I used to watch growing up on school. But then I added, then act globally, because the world shrunk with international travel. Hello, here in Australia. But what became important is that when I was at these AIDS meetings, they were talking about HIV/AIDS in all of these other countries. And I was like, how come we're not talking about this in the United States? How come? They're like, oh, the US is fine. The rates are super low. It's fine. Well, wait a minute. The numbers that for HIV/AIDS for Black and Hispanic populations in the United States are as high or higher than the numbers in these other countries where we were paying particular attention and that were getting the major talks at this meeting. So we actually do need to talk about this in the United States. And that's the thing, the note is that global health concerns are health disparities in the United States. And for those of us who want to be scientist activists must understand this and who represent those communities, because then we can go out and talk to people in those communities in a way that can breed trust. Again, another important thing that was necessary during COVID-19. And so we've seen in the United States of the HIV/AIDS population, white men who have sex with men were the number of new infections, even as recent as up to 2011. But by 2016, they had dropped down to third. Black men who have sex with men were the highest rate of new infections, followed by Hispanic men who have sex with men, then white men, and then right after them, Black heterosexual women. And that there was a point in the history of the US, I think around 2011 to 2016, HIV/AIDS was the leading killer of Black women, ages 25 to 34. Why are we not talking about this in the United States? And so this is where, Manu, get your lab in gear and let's begin to research it. And so I did start to try to do the research, but I had trouble getting collaborators in Atlanta because my ideas were too out there and we don't want to give you our samples. So I told you when I was at that first meeting in South Africa, I met Dr. Denise Evans. She was a professor at University of Witwatersrand in Johannesburg. She said, Manu, we get 400 patients a day. South Africa was the highest rates of new infection in the globe. If you can come over here, you can have the samples. And what we had developed is a really low-cost assay to monitor this enzyme activity that we knew was elevated in cardiovascular disease, and our hypothesis that it was elevated in people with HIV and cardiovascular disease on antiretroviral therapy. So we take our cheap thing over there, start using it in Johannesburg, and it's so great because it then again opened my eyes to new ways of thinking about low-cost technologies. And we weren't done with the first trip, because then we learned while there, but if you get it to the rural clinics, that's where the impact is actually happening, because then there's secret ways that the nurses and the technicians actually get medicine to people and do diagnoses. So we had to then reduce the technicality of the assay and think about new ways to engineer it down so that it could have broader impact. And that's not what I was supposed to be doing when I started this job as a professor, right? But multiple trips to South Africa, I sent a student. And then I had a collaborator who had connections in Ethiopia. So we began to do this work in Ethiopia with pediatric and adult blood samples. And there was a whole new issue presented. My student was there. We found out that they turned the power off in the building every night. How did she find this out? She would get her samples out of the freezer in the morning and they'd be wet and soggy. Now, I studied an enzyme. If you thaw an enzyme and then freeze it and thaw it, it loses its activity. She was like, this is funny. The boxes are wet every morning. And when I go to the ice machine, there's only a little bit of ice in the bottom every morning. So then we had to realize, how can we now do this assay with understanding that the power will be turned out? Not only does that affect ice, but that affects our water baths that must go at body temperature overnight. And so we then had to engineer and got to the end of the assay. That's what I call the end of the limits. We had to do fresh samples, and only then could we incubate overnight at room temperature and still get a detectable signal. We would not have figured that out by staying in our wonderful, well-lit and electrified lab in Atlanta. And that also, again, would reduce the impact we could have had globally. So these are things to think about. But also while you're there, enjoy the local nightlife too. Ethiopia has great dancing. I have a picture I can tell you later. But the other part that really struck me, again, as a Black American, as a person, as a human being, I'm a scientist, but as a human being at these World AIDS meetings, that they brought in policy, political scientists, sociologists, and the clinicians. I was hearing about the laws that had been passed and that were still present around HIV/AIDS. So in 2009, my first time going to the meeting, if you were HIV positive, you still could not get a visa to enter the United States. I was shocked. We had done PEPFAR. The US was doing PEPFAR and funding antiretroviral around the globe, but if you were HIV positive, you could not get a visa. Because of that, the International AIDS Society said, we are not having our big meeting in your country until our delegates can come and be safe, right? What? So I called my younger brother, who was a political scientist. He was a political scientist at Harvard at the time. How many of you have little brothers, have younger siblings? Right. So you know that they're trouble and they don't listen to you. So I was like, Matthew, wow, there's some amazing laws that America has passed around HIV that don't go with what we know about the science, of what the science is telling us. We should do a study. His research was around how public pressure gets Congress people to present laws for Congress, right? How public action. So I said, so we can look at the science, let's do that relationship. HIV/AIDS was less than 30 years old. He was under 30, I was under 30. We could be on CNN if we get this study published. This is back when CNN was a whole different thing also. And he was like, Manu, no. Okay, next year, and again, my parents were on his side. Those of us that have younger siblings, the parents are always on the younger sibling's side. And the next 2 years, I kept trying to convince him, Matthew, we really need to do this analysis. And he said to me, why do you think the politicians would care about what the science was saying? As a scientist, Matthew, we're funded by the federal government. They provide the funds. Of course they'll listen. He was like, I don't know why you think that. We did the analysis, and he was right. I know this is being streamed, so he'll hold that against me for a while, but he was right. But what the analysis did show is that there was impact on congressional hearings and bringing up the topic. But as far as laws being passed, it did not work. And we looked at over time, then the pandemic really spread to PEPFAR and the global problem, while the US problem was predominating in Black and brown communities. And you can take from that what you'd like. So, moving through all of that, then finally the coronavirus hit. Whew, okay? And the thing about the coronavirus is at first, everyone was locked down. And there were some great articles that came out, but then what happened? The coronavirus was an emergency, this is a paper published in The Atlantic, until Trump found out who was dying. Then another study, in another COVID-19 disparity, Black and Hispanic Americans are dying at younger ages than white Americans. And they said, oh, once they realized who was mostly dying, they said, let's open up the schools. It's bad to keep the kids at home. Let's open up the schools. This is the United States. And then once they opened up the schools, the majority of the kids who were dying of coronavirus were Hispanic, Black, or Native American. My family, I'm from New Jersey originally, but a lot of my family lives in northern New Jersey and the New York area where it was really hitting huge. But when they did the post-assessment, COVID-19 hollowed out a whole generation of young Black men. This paper in PLOS Medicine in 2021 found that through July that Black people ages 35 to 44, that's my age range, were dying at 9 times the rate of white people the same age. And the disparity was greatest in Black men. So I'm scared. I'm on the floor of my living room, I'm in the fetal position. I was living in Georgia, where though the Atlanta mayor wanted to make mask mandate masks, the governor sued her, said that she couldn't, because there was an election that was coming up, and there are people that are living through all of that. But when I talk to my colleagues, they're like, oh, we're writing review papers, this is great, we've taken the family up into the mountains, and we're at the other house, and my lab is working on things, it's fantastic. And I'm on the floor, right? And then this paper came out in the Chronicle of Higher Education, why you should ignore all that coronavirus-inspired productivity pressure. And this was written by a person who had been through, I think, government turmoil in other spaces and talked about how the world will be different after this turmoil. And she says this quote like, oh, it's your first coup? I get it, you don't know what's coming. Let's tell you how you take care of your family first, then the people you love, and how you can then adapt to live in this new world. And it was kind of like recognition that this is crazy for those of us, and it's a privilege for people that didn't think it was that crazy. So I have this thing about keep calm and not that calm, because for those that remember, what else was happening in the US was racism, which always was happening. But the murder of George Floyd and the racial reckoning that began in the US during the pandemic, with people going out and protesting, Black and brown people who were also at greater risk of contracting COVID and dying were also out in the streets because they die one way or the other. But I'm appreciative of the global protests, and there were several even here in Australia around Black Lives Matter, that to see that solidarity and everyone coming together was quite warming for those of us in the United States. And so that's this importance of allyship, I think, and I think we can't forget that. And so I have this exercise, I'll just do a few conversation bits about the power of privilege. In the United States, a lot of times people, you say privilege, like, I'm not privileged, I'm poor, I'm this, I'm that. But privilege, there's several other axes of privilege than just what we see. There's more than just gender and race and ethnicity, right? So there's those two are big ones, but there's heterosexual privilege in most places still in the world. There's height privilege. I'm 6'3". I have height privilege, and I use it. As I tell people in my lab, I have lots of short people who work with me in the lab. For some reason, scientists like to be short. But I will, if I make a new buffer, I will put it on a top shelf, and they can't get to it, right? And then I know it's pristine and made the way I want. But in a more real case, if you look at the top Fortune 500 companies, I think it's greater than 65% of the CEOs are taller than 6'2". It projects leadership, right? So I take that to an advantage, right? There's citizenship privilege, language privilege, Christian privilege, health status privilege. How many people walk around healthy? But they don't know people that have chronic illness, chronic pain, other disease where they must go to the doctor way more regularly than you might, and they must think about how they will navigate a whole entire workday, or sit still on a train that has to travel 4 hours because of some complications. Privilege. And privilege just simply means that under the exact same set of circumstances you're in, life would be harder without your privilege, right? It doesn't mean you've got it easy. Doesn't mean you didn't work hard. It's just that with an exact same circumstance with something else. So here's some examples I think we can all agree on. Being poor is hard, right? Being poor and disabled is harder, right? So a poor person, well, I don't have privilege. You do over this other person, right? Being a woman is hard in the world the way it's currently set up today. Being a trans woman is harder in the world the way it's currently set up today. Being a black man is hard in the world the way it's currently set up today. Being a gay black man is harder in the world in which it's currently set up today. So those of us need to think about how we do have our privilege and how we can then act on behalf of others and step up to be allies and not just saying, I am this thing, I am this woman or this color, I don't have any privilege. We do, we all have some power that we need to think about how to use it. And I just want to talk about in this space funding as privilege. Scientific research funding. These are people's jobs we are talking about. These professors are raising other students. And then when we have bias in who gets the funding, it affects certain populations more than others. In the United States, when I first started my research lab, a main study came out in Science magazine that all things normalized, so same institution, same number of publications, same place you educated, black professors were 50% less likely to be funded. Go get tenure, Manu. But I did, right? But I did. And so then when you talk to my colleagues, we also have a peer review in our grant funding system. You talk to your colleagues and they're like, the bias, these other people, they are really just biased in their reviews. Aren't you sitting on a few review panels? I am, and I am fair. It is these other people in my panels. Privilege to not have to think about bias in grant review, right? But maybe people should think about it to make sure their reviews are fairer or that they are checking other people in the room that are expressing bias, however implicit or unconscious. And so the last thing I just want to close with, and then I'll be done to take questions, is also as we're developing new technologies and thinking about new things and how to make things better. And again, as an engineer, I believe in design and having people involved in the early design space. We know one big impact during the pandemic was pulse oximeters. And there was ethnic bias in pulse oximeters where they were underestimating or the oxygen, or they couldn't quite detect oxygen content in black and brown skin color. So people were told, go to the hospital when your O2 levels drop below a certain point. But if the pulse oximeter wasn't reading correctly, people were dying because of the bad readings. We know this now, so there's bias in medical device design. So as a scientist or an engineer, again, I should be thinking about bias and race? Yes. Again, these no-touch soap dispensers and dryers, when I go to bathrooms, I'm in there like up, down, this and that. Okay. But what can we do there? There's also interpretation bias. American Heart Association, they have a metric or a calculation algorithm they use to determine who's at greater risk of heart problems. But it adds points to black patients, for some reason, that then says they have a lower risk of having heart complications. But they don't. Why is that algorithm there? And then as we move into the future, we all are now aware of artificial intelligence that's really coming online quickly. So we do need to think about who are we training these algorithms on? Are we being inclusive to the number of populations or people that may be, or patients may be infected? Diversity in gender, ethnicity, body types, age, pregnancy. If you are doing a new technology that doesn't include pregnant women, think about what you're missing there, not only just from a human sake, but if you're thinking about it from the dollars. Your product can be sold to more people if you know that it will work to a broader swath of the human and the human experience. And so it's really important to start bringing people in the design and testing phases of these devices at the earliest phases, because trying to course correct now, as we will have to with pulse oximeters, the technology has moved quite quickly. So in closing, do not wait until too late to think about the impact your work could have. Think about that in the earliest phases. Diversify your team, diversify your ideas, and do this at the earliest stages. And consider the impact for all humans, right? We want to have equitable care. And then also to those in this room especially, diversify federal funding and fund science that impacts marginalized communities, because the impact is more than just the people you may see in your own country, but have global impact and save lives around the world. And just remember, we can all be scientists. Thank you.
Thank you so much. That was very entertaining. I just want to come back to something that you said. You said, why do you think the politicians would care what the scientists would have to say? So in Australia, during COVID, like in a lot of other countries, it was the first time that the politicians, not entirely, but pretty well fell in behind what the scientists have to say. And Paul Kelly's here who can confirm that. But often these were the same politicians who had denied human-induced climate change. So how do we get politicians more on the side of science and more open to the evidence as opposed to the politics of ideas?
Right. So I told you I'm a scientist and not a psychologist. Yeah. No. You know what's interesting? I went to, as I mentioned, I moved to DC recently, and I went to this event that had the squad for the American, you know, Alexandria Ocasio-Cortez, Jamal Bowman, Rashida Tlaib, and the others. And Alexandria Ocasio-Cortez is something that I think gets this. I think people have to realize that they are in this together. But the way that a lot of our healthcare systems are, it's striated, right? The rich will get all the things that they will need to get to be safe. So if everyone's dying around me, certain people can escape and get away. But what Alexandria Ocasio-Cortez, what she said is, in some of those earliest conversations that the Congress people were having, when they thought it was affecting everyone in America equally, she said the things that the politicians were suggesting were things they would never say elsewise. Universal basic income, pausing mortgages, pausing, like just things that they say is just the crazy progressives. And I think it's, the way forward is if people think we are all in this together, and that as a human, again, infectious agents are one way it could be quite useful, right? That infectious agents don't care how much money you have. And if we can make people think they are just as susceptible to it as the rest of us. How do we get there? That part I don't have the answer to. But that they would recognize we are all in this together. I think then they could think the science matters for them.
Okay. Our first question is from Simon Gross from Canberra IQ.
Thanks for your talk. There's a lot of things I could ask a question, but I'll start with one. I might get another go. You talked about the dearth of STEM, of young people taking up STEM in school in the US. We have very much the same problem here. It's a first world problem. Survey last year, I said, I found that kids in about 16 think maths is too hard. And so a lot of the response in our education system has been to lower thresholds, to make it softer. And we now have, our universities don't require mathematics as a matriculation subject to go into STEM science courses in universities. It's that desperate. I just wonder, do you have any insight or theories about what's going on in the adolescent minds of US students about STEM? And do you know of any states that are doing good stuff about changing that?
Ooh. Right. So I work with, one of the things I talked about is I work with these Black high school students in Atlanta. And one thing that's been interesting in recruiting them to the program is, they'll interview knowing they are interviewing for this science program. And we'll say, what's your favorite subject or something? Like, ooh, anything but math. I hate math. Wait, you're interviewing for this science program.
Okay.
And so, I think it's, I don't have an answer, obviously that's a big question, but I think if people could, one thing that we think in the US, if people can see themselves as scientists, as mathematicians, or see people that look like them represented and show that they could do that, I think then people start to identify that this is not something that is foreign to me. So as an example, I think she mentioned my intro, I went to Morehouse College in Atlanta, Georgia. It's one of the historically black colleges in the United States, and it's actually all male. So it's basically all black men at this liberal arts college. It's where Dr. Martin Luther King Jr. went. And what it did for me in ways that my friends and I didn't fully even appreciate until we graduated was that our professors, many of them were black men who had been out in the world and industry, and I was a science major, and they were always telling us, you can do it, get that crap out of your head that you can't, right? And they would say more gruffer things in their mentoring style, but also that they had represented and been there and done it in a more difficult time than what we were trying to do it in fact. And it just kind of put in us, what are you talking about? You can do this. Knuckle up and you can do this. And I hate to be the hard person around it. So I think that matters to people. And I think if people hear their parents say, oh, math, I hated math, oh, this, that. I think all of those messages get into people's heads, but what we tell people is the jobs are huge. They pay well, they're in high demand, and if this is something you have an inkling of doing, push forward and the payoff is major, right? So I think it's about making sure we see people, connect them with their heroes or people who could be their heroes, and then kind of telling the message you're hearing from other places that doesn't have to be you.
Thank you.
Yeah.
Our next question is from Nick Stewart from Ability News.
Thank you very much for your speech, although I must admit that I was expecting it would be about serious medical issues like male pattern, white male pattern baldness. But nevertheless, leaving that aside, one of the things that really came out is the way in which you've integrated a number of different areas together to provide answers for medical problems. The other model is, of course, to really focus on a particular issue, like cancer is perhaps a bad example of this, because we're beginning to realise that cancer is a much bigger issue than just the simple physiological one. How much do you think we need to reconceive the entire way we look at disease so that it's not simply physiological, but we look at it in a broader sense?
Yes. So again, when I have my slides, I talk about the social determinants of health, right? And I began, again, thinking about working with groups. I began to work with this multidisciplinary group at Georgia Tech, Emory, other schools. And that's when I learned about these social determinants of health. If you look in the United States, where poverty is greatest, it's in the lower southeast of the United States, and also people being unemployed is also down there, and where Medicaid expansion didn't happen. And right in those areas where the greatest amount of heart disease, greatest amount of diabetes, and also those areas are where you have the greatest amount of HIV infections. So there are structural things that we have in society that cause the disease to be more dominant or progressive in certain places. And I do think there are people that are trying to bring that into the conversation, but I think if more natural scientists and biologists and biomedical people and engineers are thinking about it, then it gets it in again on the design side, again, where now I'm angling towards this molecule, let's say, but that molecule, I need to deliver this drug to it. The drug needs to be refrigerated because of the type of drug I'm developing, but I need to think, how can I make it stable and not be refrigerated? And let me start that early so I can make sure I get to people who don't have home refrigeration or something. So I think we need to start training our natural scientists and people asking purely, quote, science questions, the broader consequences of how we want to deliver healthcare.
And male pattern baldness?
And male pattern baldness, yes, particularly for white men.
Our next question comes from Youssef Saudi from SBS.
Hello, yes, I'm Yusuf Saudi from SBS World News. It's great to hear your incredible speech. I'm glad that you pursued science rather than playing basketball. That's great to hear.
I did play basketball, my brothers were just better. Okay.
Yeah, that's why I chose journalism as well. I'm not tall enough. Anyways, so you talk about the idea of trailblazers and science can be for anyone, but what do you think you would like to see when it comes to changing the landscape for the industry and, you know, hiring more diverse people?
Yeah, you know, it's, well, this is being recorded, right? I was in charge of admissions and recruiting for my biomedical engineering department at Georgia Tech for 5 years before I left. And again, we're now ranked #1 in the country in the United States. Woo! We were #2 for years, but now #1. And then I left, right? But one thing that to push through, there were several different phases that we had to go through to increase the numbers of our diverse students that we took in, right? But by the time we were able to take in 20% African-American students in our class, and again, the US percentage is only 13% black, so even above US. But there were several steps that I think we had to do that work for other organizations, and even not just grad students, but for hiring at your company or whatever. The first thing is you have to get good applicants that apply. What does that mean? There are people who think your company is terrible, and they know it has a history of being prejudiced and racist, and they're like, I'm not gonna go to work for that company. And being honest with oneself about, we have this reputation, what can we do to go out and fix it? And that's where sometimes community service, we did our Project Engages with the high school students, can help there. Then you have to get people on the review committees to be open to diverse groups, right? And so some of the conversations there become about we don't want everyone that has a 4.0 or the highest grade here, because what else are they gonna bring to us to solve these questions? And this student who went to this university that has this great experience, and maybe they've got a lower GPA, but they have this great experience, will bring that experience to our university to solve our questions. And so you have to start pushing on those efforts that then cause the review committee to change their minds about what is the perfect candidate. Because again, there's bias there because, well, they went to the school I went to, so they're the best candidate, right? And so it's not even always about race. But you've got to break them in and again, be explicit about exercising that oversight. Then that doesn't mean the person you then have extended an offer will come to you. Because then when they visit and on that interview day, they go out to a dinner with people, and if it's a woman, you let the sexist manager go out to dinner. And she says, not coming here. And so when people tell me things like, well, we don't know who's sexist and we don't know who's racist, you don't. You wanna know who's racist? Ask the black person, they'll tell you. You wanna know who's sexist? Ask women. They'll tell you, right? And then you need to keep those people away from those candidates. You do, in the earliest days. Now, when they do their second visit, they need to know what they're walking into. But that first impression, if there's somebody who's a marginalized person who has made it up through the ranks to be in a position to get that offer, they've seen landscapes. And at the first red flag, if they have another offer that's no red flags, I'm out. So you've got to make sure you check the people that you work with and have those conversations. Then they might want to come in, and then when they come in, now you've got to make sure when they're in the organization, there's an inclusive environment and people aren't walking around saying they only got in because she's a woman. They only got in because they're black. And that's where the allyship comes into play, where others have to step in and say, hey, that's not at all why she got hired. When they hear that off conversation in a hallway that you thought was by yourself, but somebody else has walked by and heard it, and it might get back to the candidate. So it's all of those different levels that then get in, but when you start to have a stable, successful population, the word spreads, and more will want to join the organization. But it's not just, we educated everybody and did a D&I training, they're all gonna come. It's those one-on-one things, and it's the subtleties. Because if people think someone who's from a marginalized population doesn't catch the subtlety, they're fooling themselves. Yeah.
Thank you,
Yeah,
really
you're
appreciate it.
Can I just, while we're on that, can I just ask you a question about early career researchers?
Oh, yeah.
So in Australia, it's very hard, I think a lot of people in this room would agree, it's very hard to establish a career in science, especially in the academic realm, because it's very casualised, there's a lot of contract work. You know, survey after survey points to gender discrimination, you know, low rates of promotion for women in particular and for minorities. Gender pay gaps, all that sort of stuff. So what would you say to a young career researcher who's struggling, one, to get the postdoc and then take the next step after that about just hanging in there, or, you know, is it just easier to leave sometimes and go and become something else like a journalist?
I think science journalism is a fantastic field, I really do. So I've trained up 10 PhD students in my time in the academy, and 4 of them were black women. Mm-hmm. Hardest thing I've ever had to do, right? Not because of them. And we've had these discussions. 3 of them are now professors, right? In the US, not in the Australian system, which, whew, right? That's a huge deal. And we've had all those conversations about, is it worth it, should I? And half of them didn't want to be for most of their time as a PhD with me, and I was like, well, I'm not pushing it. And then what changes? I tell people, when I became a professor, this, as you found out, was not my first job choice. I was going to go to NASA, right? And then things had changed after the Columbia shuttle disaster that then, And I thought about, what do I want to do every day? Because it's not about what I want to be. You think about what you want to be, that puts a lot of pressure on things, and there's like categories. What do I want to do every day? I like science. I like being able to talk about science. I like working with young people. I like free food and travel. Facts. Who does that? Who does that? I don't know who does that. And my friend was like, dummy, professors do that. I got it, that's the job. And so when I got behind that door, again, I'm in the US system, so we'll talk about this stress. The opportunities and what that job brings is so much more than what's even advertised on the surface when you're a grad student or a postdoc. And I think you can't even tell others all that goes with it, right? And I think they want to keep us out of these good jobs. I tell people, they're making it hard because these are some sweet positions. That's why they are staying in them so long, right?
Yeah.
Because they are really good jobs, despite what angst we have felt during our training in graduate school. But when you they are wonderful jobs. And that's one thing if people can look that long out, right? Then I think people have to decide who they really are. For me, I could not work in industry because if they told me to change the science directions because it was going to affect a small population and I was having impact and it was moving forward, it would destroy me. What else am I supposed to work on? For me, that would not work. And so I really think about who you are and if you can get through it to the good promised land. And everybody can't, and I accept that and I understand, and then people have other things they balance to being happy. So that's the third part, what makes you happy? And career is not the major weight. If there's these other aspects that really you would value and you would live a full, happy life without that, then go and pursue it. But I would say, think real about themselves. What is this pathway? Talk to lots of people about how they navigate it differently, because I think we also can tend to look at the one who had it the hardest, because they will be the most vocal about their path. And the way that I got tenure as a black man in America wasn't the way that my South Korean PhD advisor got it, not the way the 80-year-old white man who'd been a mentor for me for years got it, not the way the white males who started when I started at the same time got it. It was a very different path. And me doing all of this diversity and outreach while I was pre-tenure should have made me not get tenure. And everyone said, this will stop you from getting tenure. But what they realized and missed is I work with these groups because they bring good science ideas to me. It's not just me doing charity work. They are bringing new ideas that we are putting in the lab. They are then making me think about things differently. And they are working in the lab. When I couldn't recruit someone else, I've got these hands. So if you look at every person as they can contribute, again, that's a whole set story, but that is how you will navigate this space may not be the same as someone else. So that's all I can, but they should make their own decision that's best for them.
Thank you. Our next question is from Maurice Riley, the CEO of the Press Club.
Thank you, Professor, for your speech today. China's rising. We see words like strategic competition. The new buzzword is de-risking, which sounds like a trade barrier to me. How's this going to affect scientists? I mean, the great solutions in the world are through collaboration across the world. How do you think it's going to affect scientists here in the West? And are we going to find ourselves increasingly in an environment where it will be difficult to collaborate with our good friends in China?
That's good. That's a really important question. Yeah, that's a really important question. And the first simple answer I would say is we have to watch where those conversations are because of security issues and where they're because of racism, right? And I think we have to make sure we're distinguishing what the nadir of those, or what's the birthplace. My department, I actually spent the summer of 2019 in Beijing, China, right before the pandemic, right? We have a joint relationship with Peking University, and I was over there teaching. And we all know who was president in the United States in 2019, and the China thing started already to change. And when I was there, Peking is one of their top universities, and the shocking thing, I'm American, that's why it shocked me, I shouldn't have been shocked. But I met so many other international students that were choosing to go to Chinese universities than United States universities. And I asked them why, and because these students could pay they could afford to pay. So that's money that we were losing, right? And they were choosing there because they were like, well, the United States is not a welcoming place to internationals anymore, guns. And they were saying these things that it just hit me like, we are really losing talent. And from the financial model, the universities are losing money. And they had already started to count those numbers of dollars that were dropping because of reduced international students coming to learn in the US. So again, if the money is what people need as a motivator, you're losing money, and it's not just from the Chinese students, you're losing it globally because other people are choosing them over us. So we should think about that. But what the important piece is the collaboration. I mean, having diverse groups and people who think about things differently, I think that's one thing that makes the US so successful in scientific innovation, because number one, people from around the globe would like to come there if they are from an oppressive country or some other place. Your brilliance can come here and we can take it in. And China has very brilliant people, just like other countries in the world does. So I think the concern there is, if it is a security issue for all the well-vetted rationale behind national security concerns, then I'll let those experts deal with it. But if the root is a racist issue, then I think that's something that we need to push back against.
Thank you. We've got a question here from Associate Professor Tony Kenner.
Thanks, Manu, for a great address. I'm going to follow up on Julie Hare's first question. So you talked about Survivor at the start. Many of us scientists, academic researchers in Australia think that we're in a giant game of Survivor. Funding for research is at an all-time low here, and we look at the US as some kind of funding utopia. So per capita, you're funding about 3 times the rate that we are in health and medical research. You talked about engaging and connecting with politicians. So what can we learn from you in America about engaging with our federal politicians, not just to get them to trust the science, but also to fund more science in Australia?
Right, great. I think the first point is what I said earlier is we can't leave that to others, right? We can't say, I am a scientist, I am at the bench, others will do the advocacy. We can't do that. We don't have that as a, we don't have that luxury anymore. So scientists, though we are all socially awkward, pull up your pants or your skirt, and we need to go and interface with our politicians. So in the United States, again, NIH, it's a tough funding model. I know it looks like there's a lot of funds, but there's a lot of professors. So we do have to fight for that money. But, so there is, as mentioned in the introduction, it was a great introduction. I'm a fellow of AIMB, the American Institute for Medical and Biological Engineering. And it's funny, as I've been here for the ASMR visits, they actually have a lot of similarities to ASMR, and that they take scientists and connect them with policymakers, and they are a lobbying organization as well. And so since I've been a part of that, you have to be like a certain level of a scholar to make it there. But they set up regular meetings where we interface with our own representatives. They give us the text to use to contact them. And then they also send out like calls of action for things that they want everyone to start jumping and sending in immediately. And I found that, again, once I became a fellow, I was like, wow, they want us to do all of these things. And we all think I'm so busy doing all of the other things that I'm doing, but there is time that needs to be made, because if we don't have the funding available, then you will have plenty of time to do this in the future. And so I think it's about helping our colleagues recognize that for those of us with the skill set, I don't say it's for everybody, but for those of us that with the skill set or those that can learn the skill set, we should be coming to the press club and meeting with politicians, but then talk to our local politicians and their staff, because they do have ways to get things on the books or in front of the politicians. So we've got to do more. And I know that sucks because we're doing a lot of things already, but I think those of us that have that bandwidth and that personality should step out and do a little more.
Okay, our last question is from Simon Gross.
Okay, bandwidth and personality. You said in your speech you're a scientist, an engineer, and a nerd.
Yes.
Now, that is a CV that is for a lousy administrator of an NIH centre and people. Now, it's obvious from your presentation that you've got some personal attributes that may mitigate that shortcoming. But I just wondered if you have I know that it's the same in journalism. People get to a stage of they rise up and become administrators and they're lousy. Same in science. Do you have any 3 points or a philosophy about how you manage your staff and bring the best out of them?
That's good. That's good.
Come on, listen.
They're not watching.
Go.
They're 14 hours behind. They're asleep now. Yes, I do. These are things that work for me. I loved when Tim Cook, the CEO of Apple, came out and he said, "Bring your whole self to work," right? Okay. That really hit me big because, again, as I mentioned earlier in the talk, I don't look like what people think scientists look like, right? I don't laugh like how scientists look because I laugh boisterously, quite loud. I have several other interests than science that take my time and that I get full enjoyment about, but that I will bring into the science. When I do a regular science talk in the US, lots of pop culture references. I didn't know if they'd pull off here in Australia because,
But that would turn some scientists off. Scientists can be really dour nerds.
So, but I can talk nerd. So here's the thing. So right, I can talk nerd. But the way I bring that up is if I am this type of scientist, I'm not saying every scientist is like me, but however you are as a scientist, you can be you in our group. Right. So I say I value everyone for who they are, right? And so I actually run in my research team a very flat structure. So you see some tiered labs of there's the professor, and then there's the postdocs, and there's the grad students, and the undergrads and high school students. I run a flat structure. I meet with everyone when I have a small enough group. But the high school student that I had in my lab, they are expected to present at journal club and at lab meeting, just like the postdocs that have been there for 4 or 5 years. They're expected to ask questions because you contribute to what we're doing just like somebody else does. And if we get the high school students scared to talk, we may be lost in this dogmatic tunnel we've been in, and they can see something so fresh and be like, why did you just try it like this? And that's why I run a flat structure where everybody feels included. Everyone feels included, but they also are responsible for contributing, right? So it's not just, oh, you can speak up when you want to. No, we expect you to speak up to bring your ideas to help the others project. And I think that's helped me as I've become an administrator because being the only in the many rooms, right, whatever you want to call the only, I'm going to I'm going to say what was on my mind, right, in a meeting, despite. I'll say it politely and respectfully, but others will sit quiet and say, well, I'm going to say what's on my mind because I feel like if I have a thought, I'll share it. And so now when I start to lead meetings, and when I have been doing it, I look for nuance in people. When people are twitching because they want to speak, but somebody else keeps talking, I'm going to watch that and then say, hey, I think she wanted to say something, jump on in the conversation, right? To then in all those meetings make everyone feel like they are part of this team, and it's not a waste of your time to be here, even though you can't help that sometimes. But that's where I want to build a team where they all feel responsible, they all feel included, and then we can all share the success together because we all got here together, not just by my harebrained idea all alone. And I think that makes people feel respected and bought in. But then I also tell people, this is the catch-22 too, if you have a problem with me, I expect you to come and tell me. In my office, now I don't like you ain't cussing me out in public, right? But in my office, where I'm a human being, you're a human being, talk to me. Let's talk respectfully, but if there's something that's on your mind, let me know. I'm not gonna guess it. If you keep it from me, and that won't be positive, that you're just building up anger and we never talk about it. So come and talk to me. To the point that now I do, my sister-in-law, she helped put this together for me. I do an assertiveness training with my research team because if they're scared to talk to me, they're scared to talk to each other, or they're scared to take on peer review, right? We need to learn how to push back. And they use it on me when they want to push back. And I think that's what makes it all like I am in the trenches with them. I get paid a little more, but we're all on the team together. And that's what I found has worked in some of these situations.
Good stuff. Thank you.
Thank you.
Thank you so much for your time today.
Right.
I would like